If you're a parent, you know the feeling all too well. Your baby spits up after what feels like every single feed, they seem fussy, and you're just drowning in laundry and worry. You can't help but wonder, is this normal or is it a sign of something more serious? So let's get into it because this is honestly one of the biggest anxieties for new parents.
This really is the million-dollar question, isn't it? It's the one that keeps you up at night. Today, we're going to tackle it head-on. We'll use expert guidelines and the latest research to really untangle the facts from the fears and give you a clear, confident path forward.
Okay, first things first. If you are dealing with a baby who spits up constantly, I want you to know this. You are in very, very good company. This isn't just common, it is practically a universal part of having a new baby. Now take a look at this chart. It really tells the story. According to data in Active Pediatric, in those first couple of months, half of all infants are spitting up every day. Then it actually peaks between 3 and 4 months. We're talking nearly 2/3 of babies. But look at that last bar. By the time they hit their first birthday, it plummets to just 5%. The takeaway here? This is almost always just a phase.
And this quote from the American Academy of Pediatrics is so important. They're crystal clear. If your baby is generally happy, they're growing well, but they just happen to spit up a lot, they're what's called a happy spitter. And for these babies, medication is not the answer. This single idea sets up the most crucial distinction we need to make.
So, let's talk about that distinction. This is where we have to separate a totally normal process from an actual medical condition. The words sound almost the same, but trust me, understanding the difference is absolutely critical for your baby's health. On the left, you see GER. On the right, GERD. It's just one letter, but it represents a world of difference. See, GER is something that pretty much every baby has. GERD, on the other hand, is what happens when that normal process starts to cause real trouble. Getting this right changes everything.
So what exactly is GER? Well, the official guidelines from pediatric specialists define it simply as the movement of stomach contents back up. That's it. It's a normal, harmless process. You can think of it like their internal plumbing system is just still maturing. This is what all those happy spitters have. Now, GERD, that's different. That's when the reflux leads to genuine problems. We're talking about medical complications, like the baby isn't gaining weight properly or they're actively refusing to eat because it's uncomfortable. So remember, GER is just the action of spitting up. GERD is the actual disease that can result from it. But, and this is key, it usually doesn't. All right, now we get to the part that might actually surprise you. Most of us, myself included, assume that when a baby is crying from reflux, it must be from stomach acid, right? Like heartburn in adults? Well, as it turns out, the science tells a very different story. I mean, it's the most logical question. If my baby is crying and seems to be in pain, something must be hurting them. And we associate reflux with that burning feeling, so we naturally connect the dots to acid. But is that really what's going on inside these tiny bodies? And here is the myth-busting number. This comes from a 2023 expert consensus. Get this, up to 56%, so more than half, of all reflux episodes in babies are not highly acidic. Many are weakly acidic or not acidic at all. Think about it. Their stomachs are mostly full of milk, not the same kind of harsh acid as in adults. This one fact changes the entire game. This quote really drives it home. The experts are saying it's often not the acidity of the spit up that's causing the fussiness, it's the sheer volume. Just imagine the physical discomfort of a large amount of liquid coming back up your throat. For a lot of these babies, that feeling of fullness and overflow is the real culprit, not some kind of acid burn. So, if the problem isn't always acid, that brings us to a huge disconnect in how we sometimes treat infant reflux. We can easily fall into what I call the treatment trap, using a solution that just doesn't match the actual problem.
And these are the medications we're talking about. You've probably heard the names. They're called PPIs and H2 blockers. And these are powerful drugs designed to do one specific thing: shut down the production of stomach acid.
Okay, this slide right here might be the most important one of all. An international panel of experts came to 100% unanimous consensus. Let me say that again, 100% agreement. They said that if the reflux isn't acidic, then using these acid-blocking drugs is not warranted. It's like trying to use an umbrella to fix a leaky faucet. It's the wrong tool for the job.
And it's not just that these meds might not work. There's a growing pile of evidence showing that they can carry some real risks for little ones, especially when they aren't truly needed in the first place. And this statistic is pretty sobering.
Research shows that children who used both types of these acid-reducing medicines before they turned 1 had a 31% higher chance of bone fractures later in childhood. The study suggested the earlier they start and the longer they're on them, the higher the risk. That's a huge potential downside to weigh.
Okay, so if jumping to medication isn't the answer, what should we be doing? Well, the great news is that the official guidelines from experts in North America and Europe give us a clear, safe, and really effective step-by-step plan. This is all about empowering you, the parent.
Here it is. This is the roadmap. And notice the order. What's first? Simple stuff, like avoiding overfeeding with smaller, more frequent meals. Step 2, thickening the feeds, which is a great first-line approach. Step 3 is thinking about a potential milk protein allergy, so trying a different formula for a few weeks makes sense. And look what's last on the list. Only after those other things don't work, a short trial of medication. It is a later step, not the starting line.
Now, of course, everything we've talked about applies to that simple, uncomplicated reflux. It's just as important to know when something more serious might be going on. These are the red flags that mean you should absolutely stop guessing and call your doctor.
This list comes straight from the expert guidelines, and it's your essential checklist. We're not talking about a little spit up here. Persistent, forceful, projectile-style vomiting, that's not normal reflux. Green or yellow vomit, that can be a sign of a blockage. And of course, a fever, poor weight gain, or suddenly starting to vomit after 6 months of age. These are all signals to get professional medical advice right away.
So, let's say you decide it's time to see the doctor. Whether it's for one of those red flags or just to talk about the plan, you want that appointment to be as productive as possible. And the best way to do that is to go in prepared.
Here are 4 fantastic questions, adapted from the Mayo Clinic, that can help guide that conversation. Asking for the most likely cause gets the ball rolling. Asking for the best course of action is direct and to the point. But my personal favorite is this one. What are the alternatives? That question ensures you're having a full discussion about all the options, including the lifestyle and feeding changes we just talked about, and not just defaulting to a prescription pad. So, what's the bottom line here? The big takeaway is that for most babies, reflux is just a normal phase they have to grow out of, not a disease that needs to be cured. And when we understand it's often about the volume of spit up, not the acid, it completely changes our perspective. By questioning the quick fix and trusting the evidence, you can navigate this super common parental worry with confidence and choose the safest, healthiest path for your child.